Aloha kakahiaka, everyone. Good morning. Mahalo and thank you to everyone for being here for AlohaCare's internal webinar series, Enlivening a Culture of Health. We're going to start in just a couple minutes, and as we welcome all of our teammates who are logging in, they're connecting their audio, they're connecting their phone devices, please familiarize yourself with the Zoom webinar features. Especially for those of you who are joining us for the first time outside of a Zoom meeting platform like we usually use. We are going to have a presentation today. So if you can see your screen, that would be great. Great information is going to be shared from our guests. As an important reminder, please join the webinar live without logging into Citrix or your VPN. That will help to optimize our video and our audio and make sure that we have less delays. Please also keep your use of Aloha lines in the web browsing to a minimum while you're on live with us to make sure that we keep the bandwidth as high as possible. On the screen here, we have 5 slides, 5 portions of the slide for you to look at. We're going to be using the chat feature. Good information is going to be shared there. So there's going to be lots of links and resources. And then we're also going to be using the Q&A box. So if you have any questions that you want to ask, please feel free to drop those in. And then we're definitely going to save time for an open discussion later with our panelists. And then lastly, we are recording this session, and for folks that are unable to join us live, they can rewatch it later on Aloha Lines, and we're recording the screen and the audio. We're not recording any of you, and we're not recording the chat either. With those brief tips to orient you, we want to welcome everyone warmly this morning to the 11th episode of our Enlivening a Culture of Health series on Zoom webinar. Our esteemed panel today is going to help us continue part 2 of this series, and we're really excited to have 3 panelists, esteemed colleagues from Hawai'i Dental Service, senior executives here that are going to discuss ways that they're leading affordable, comprehensive dental plans for individuals, families, as a local organization. They're helping their members live well and smile more. And more than 95% of all of licensed practicing dentists in Hawaii participate with HDS. And so they're creating the largest network of dentists in the state. This is important for us because at AlohaCare, we have 2 important initiatives that are underway. Our cultural competency plan for health equity is one of them. It's really important for us to make sure that we have an integrated and intersectional approach to understanding the needs of our members, of our providers, and for all of us as employees in the communities that we serve across all islands in Hawaii. We also have a really important initiative, and that's our understanding and improvement of the structural and social determinants of health. This is instrumental for us to promote better health and improve health equity among our members. And so today's episode is aligned to one of our pillars, that's the healthcare system alignment. This is really important for us today because we're committed to diversity, cultural groups, that intersectionality across disciplines to make sure that we work and learn with external experts all across the state, and that we work to accelerate the elimination of unfair and avoidable differences in health among population groups, which might be defined socially, economically, demographically, or geographically among our members. Without further ado, it's October now, and this month is National Dental Hygiene Month. In our 11th episode, we're tying to AlohaCare's SDOH pillars for that healthcare system alignment. After 60 years of helping Hawaii's people and celebrating their 60th anniversary, HDS is the first and leading nonprofit dental service corporation in Hawaii, with more than 1 million members, including Guam and Saipan. This webinar today is going to focus on shared commitment to serve the members' whole health right here in our own community. We get to work with HDS often on a number of projects and initiatives, so we're excited for this joint learning session. I'm actually going to start us off with our first poll. I know it's a little bit early, but we're going to get everyone drinking their coffee and drinking their tea as they listen in. So the first poll is going to come up on your screen. You should see it and go ahead and choose the answer that best fits. When do you think the child should first see a dentist? Maybe by age 1, 2, 3, 6 months after their first tooth falling out? Maybe around 7, right? They're starting to go to school. That kind of stuff. So feel free to answer. And I'm not going to actually give away the answer yet because Dr. Uchida is going to tell us a lot more about this and his initiatives that he's working on a little bit later in the episode. But now I really want to introduce everyone to our panelists today, who are highly regarded and respected leaders in the field for improving oral health and dental care. AlohaCare is really proud to work with them. Dr. Diane Paloma is here with us today, Shere Saneishi-Kim and Dr. Gavin Uchida. So in addition to coverage, of course, they're also going to talk to us about health-related programs and projects to talk about oral health education, prevention, their partnerships with the community, and share more about HDS Foundation, which maybe some of us don't necessarily know enough about yet. And then this is an opportunity for us to learn more. So without further ado, I'm going to turn off the poll and I'm going to turn it over to Dr. Diane Paloma.
Okay, aloha kakahiaka kako e na hoa makamaka o Hawai'i nei. Aloha and welcome. Good morning, everybody. Thank you so much for inviting us to your, what I learned was a monthly webinar, and being the 11th one, I'm sure you have this wonderful library of resources for the community partners here in Hawaii. I also just learned that some of you are logging in from out of state, so aloha to all of you. Thank you so much for having us, and I'm just so excited to be able to share with you a little bit of the piece of what we do at HDS. I'm not going to go too much into some of the statistics. Kealoha, Dr. Fox just actually did probably the first 3 slides of my normal presentation. So just saying, we are big, we are the largest, we are very proud of that, and we've been here a while. Let me just get right into it. Oh gosh, okay, so that's me. So you can compare the real life version to the nice photograph, professional headshot. But a little bit about me. I came to HDS in November of last year. I am approaching 1 year. So actually this 11 months marks the 11 months of my employment here at HDS, the 11th episode. And I will say that I came from Lunalilo home, and I first learned really and worked with HDS in my role in kupuna care. I also worked a little bit with AlohaCare, as some of our Lunalilo home residents were AlohaCare members, many of them, of course, on Medicaid, and looking out really for the well-being of Native Hawaiians has kind of always been my premise. Our mission is to create a lifetime of healthy smiles for Hawaii families. So really, not just a strict, straight health insurer, right? Or a dental insurer. This year, we are lucky enough to be celebrating our 60th anniversary. And you'll see that we kind of upped our game a little bit. We had a logo reflecting the kalo leaf, because as a local company founded in 1962, we really wanted to reflect those local roots. And if you can get the pun, very intentional, the local roots here at HDS, the kalo plant, right? The root is what we use for poi, pa'iai, kalo pa'a. And surprisingly, or maybe not even surprisingly enough, kalo does have a significant source of fluoride in it. So much so that I think there are past documented studies done on the well-being of the oral health hygiene versus non-kalo eating. So I think it was Dr. Hillebrand at Queens, one of the first physicians who actually did a study on his own kids. He fed them poi instead of rice or potato or some other starch, and found that his kids' oral health was much better than the other kids in their classroom. So one of the first studies done in oral health care, I think, in Hawaii. We're just honored to be here working with you for the past 60 years. We also see the significance of oral health care in Hawaii, right? Because the mouth is not necessarily a different part of the body. Although many times in our insurance industries, we tend to forget that. What I see as the intersection of HDS is that four main beneficiaries or constituents, is how we really see it. Our own employees, right? We invest a lot in our employees to be able to provide that service to all of our partners. Our network dentists, of course, are the ones that deliver the immediate and direct care to our members. The next on the top right, our HDS members. That includes some of you here on the call, those of you who have HDS as your oral health care insurance carrier, and the employer groups. So you as an organization, AlohaCare as an organization, we want to also provide competitive pricing for your employees. And like Kealoha said, we serve a number of people across the state of Hawaii and in Guam and Saipan. You can see this is a breakdown of our membership. Majority, of course, is going to be in group plans. Those are our employer groups. The MedQuest business also, you guys are very, very familiar with this. And this is where we partner on a lot of initiatives, takes up another big bulk of our membership. What we've seen, although the individual plans at 3.1% look a little bit small in terms of this pie chart, during COVID, we saw a rapid increase in individual plans as members either lost their jobs or were furloughed, and they picked up a lot of individual plans. And we're actually anticipating that number probably to shrink just a little bit more as our economy picks up again and more employers are offering our plans through there. Government programs we'll go through a little bit later. But again, the newest part of our pie chart business. So for our commercial business, right, this is where our employer groups, we have a lot of initiatives that we'll go into a little bit later. Preventive care, of course, with cleanings, our Smile Well program, I'll go through a little bit later with our employer groups. Total Health Plus is also one that I want to highlight. It offers additional cleanings and additional services to higher risk priority groups. We'll share a little bit more about that later too as well. And then of course, this is where HDS and AlohaCare partners the most together in our government programs. HDS Medicaid, our supplemental Medicaid, really AlohaCare has led the way in being able to provide this supplemental coverage for AlohaCare and HDS members. We've also found initiatives and ways to try and encourage more dentists to participate in this network. And then the largest growing network, I think, that we see on the horizon, which integrates a lot with our Kapuna Care, is the Medicare Advantage markets. Okay, and so really what I really wanted to highlight today is not to just rattle off the statistics of HDS, but really share about what HDS is doing in the community, specifically the Hawaii community, of course. And we do that through a foundation, which was created only about 4 or 5 years ago. And I'd like to introduce Shere Saneishi-Kim, who is the director of the HDS Foundation, to give us an overview of really the great stuff that we're doing in the community. So I know I've already taken way more time than allotted, so let me pass this over to Shere and I'll be quiet for the rest of the time until I have to come back. Hello. Shere, take it away.
Thanks, Diane. Good morning, AlohaCare Ohana. Thank you for logging in first thing this morning and allowing me to share about the HDS Foundation. Okay, so I wanted to share what the foundation does. We're a sister company of HDS. We are a 501c4 organization. We're funded by HDS to improve oral health in Hawaii. So that's all we do is different types of work to improve oral health. We provide several different things. We do grants for the communities, as well as scholarships for students. And then we also work on our own oral health initiatives throughout the the company. Okay, so this slide shows that we have two ways that we give funds through the Smile Fund and also through grants. So the Smile Fund is we'll receive requests up to $5,000 for Smile Fund, and then also the grants you can request for over $5,000. In the past decade, we've given over $12 million in grants, and the grants are awarded for programs and projects focusing on the primary areas of the promotion of oral health education, prevention of oral disease, and increasing access to dental care. Our giving and programs target underserved communities, Medicaid recipients, and the uninsured as well. Okay, see, this is an example of some of the grants we've given last year, 2021. We gave to 19 different nonprofits, and many of them, as you see, are, I didn't list all of them, but many that you see are actually our partners in the community, our FQHC, community health centers that have dental clinics at their center. So we've supported like expansions of dental clinics with equipment, supplies. Also, many of the community health centers do oral health outreach programs in the school or in community. And we've also supported pilot programs for teledentistry. And also, I'll talk more about, but sealants in the schools. One of the questions we often get from the community is, and we get this from our HDS side, as well as where the community work that I do, but they always ask, like, where can I get free or discounted dental services? So we compiled a list of the free and discounted dental services by island. So this is an example of a list of Oahu, just a portion of it. But it is all on our website to list some of the resources they can go out to the community. So, not all of them are free, but a lot of them have discounted services, like if you go to the community health centers. So we have this by island. It's on our website at hdsfoundation.gives, in case you need to refer anybody to this list. Scholarships. So we provide scholarships to students, and this year we just awarded 8 scholarships, 4 scholarships to dental hygiene students and 4 to dental students. The dental hygiene programs are here in Hawaii are at UH Manoa and also at UH Maui College. Just happened to be that the 4 dental hygiene recipients are studying at UH Manoa. They receive $5,000 each. And the dental students, unfortunately, we don't have a dental school here in Hawaii, so they go out to the mainland to study. And we've given them $10,000 each for their studies. Many of the students have received this for multiple years. And the good news is next year, we will be expanding our scholarship program, and we will be awarding up to $100,000 in scholarships. So we'll have an increase in that, which I'm happy for our students. We continue to build relationships with these students and encourage them to stay in Hawaii, and for dental students to come back home to join the dental profession in Hawaii. And you can help us spread the word about our scholarships if you know any of the students are pursuing a dental profession. Okay, next I'd like to talk about the oral health initiatives that we work on year round. There's Seal Away Decay, Kupuna Smiles, and Dentists by One. We're also active members with the Hawaii Oral Health Coalition, which is a great organization. And if you're interested in oral health, please join us. We meet a lot of different people who have some kind of a stakehold in oral health. So it's really good networking to work together with the community. And they have been kindly assisting us with many of these projects that we've been working on. Okay, we'll start with Seal Away Decay. So we have a partnership that we funded Hawaii Keiki, that's run by UH School of Nursing. And we provide sealants in the schools. Sealants are thin protective coatings that are placed on the back molars to help prevent cavities from forming. And we started this program in 2020, just before COVID started. So we were delayed a bit, but last year we were up and running again. And we take a team of dental professionals to Title I schools, elementary schools, and we provide oral screenings as well as sealants if they need them. Last school year, we visited 28 elementary schools on Oahu, Maui, and Kauai, and we provided oral screenings for 650 students and sealed a total of 1,400 teeth. And then we also identified 28 urgent referrals. So urgent referrals are when they have some kind of pain. So that would, mean that they need to see a dentist right away. So, we're glad to be able to go out to the schools and reach the children where they are. We're planning to do even more schools this year, and we plan to also expand to the Big Island. Okay, our next initiative is Kupuna Smiles. This is an oral health training for caregivers. So we learned that there was such a need with the senior population, especially at long-term care homes, that their oral health was suffering. So we decided to create a program that would take a team of dental hygienists to visit long-term care homes and train nurses on how to care for their teeth. So we began this in 2019, again, just before COVID hit. So obviously we were really, not allowed to go to visiting homes during 2020, 2021. But I'm glad to say in 2022, we visited 4 care homes and trained about 200 nurses in oral care. Next year, we plan to expand to the Big Island and eventually statewide. I think Diane wanted to say a few words on this.
How I was introduced to HDS and partnered a little bit was when I was at Lunalilo Home. We were one of the first pilots of HDS Foundation's Kupuna Smiles program to come on site and train our staff. And when they arrived, I got so schooled by them. I was so proud because I had laid out, we have this it's called a mouth swab. So it's like, I'm sure you've seen it if you've been around healthcare. It's like this puffy, spongy tip on the end of something that looks like a lollipop stick. And it's an oral health swab, right? So if you can't get up to brush your teeth and do the full cleaning, you kind of just swab this around. Well, anybody ordering those, I was told to just like stop altogether and cancel those, because those things, I was told, actually spread the plaque versus really, you're probably doing a little bit more harm than good in those. And so without this training, we would have never known that. And we totally revamped and changed the way we do oral health care, or I'd say at the time at Lunalilo Home. And so I just was totally floored. I thought I was being so proud that we had this on like regular standard order, and they're like, stop ordering those. So fun story, but that's how education gets out in the community. Without them coming, we would have never known. So thanks, Shere, for that.
Thanks, Diane. Yes, a simple toothbrush will do the job. Okay, our third oral health initiative is called Dentist by One. And I'm going to pass this over to Dr. Gavin Uchida. He's a pediatric dentist, and he also works with us on the HDS Foundation, and he'll tell you more about our third initiative. Gavin?
I'm the one who gets to talk to all of you, so thank you for joining. I'm going to talk to you for a few minutes, and we're going to bring this conversation back to you guys a little bit, because like Ke Aloha said in the very beginning, Hawaii is a very diverse place, and we have a lot of different subsets of our community and a lot of different cultures that all live harmoniously in Hawaii. And so those cultures can be different. I'm going to ask for your help. And one of them is to listen to what we're talking about today and try to spread the word with what we're doing, and try to think if there are any people or organizations that you know that could benefit from what we're doing. For example, we have a scholarship program where we give thousands of dollars to help tuition for people who are either going to dental school or dental hygiene school, or we might even consider doing this for people who are considering being dental assistants. Do you know anybody that could use free tuition money to go to dental hygiene school at UH Manoa? If you do, spread the word about what we're doing. Or like Diane said, we have a program where we're training we're training medical providers, nurses and nurses aides on how to just help people brush teeth a little bit better. Do you know anybody who might benefit from that type of education? So we want your help in spreading our word for the programs that we're already doing. We also want your help in creating new ideas for new projects and new programs that we have yet to develop. Do you see a problem in your community or surrounding your family that maybe is also occurring in other places? So the short of it is we want all people to regularly go to the dentist. And maybe somebody's on Medicaid, maybe somebody has private insurance, or maybe somebody pays for things out of pocket. But we want all people of all ages to go to the dentist on a regular basis. We're viewing that maybe one area that we can help encourage this is let's focus in on infants, because if infants go to the dentist from an early age, they're going to become children who are comfortable going to the dentist on a regular basis, who are going to become teenagers and adults who like going to the dentist. So the idea is we get people comfortable going to the dentist, and we also get adults comfortable going to the dentist, taking their child, and then maybe that adult might also schedule a dental appointment for themselves. So we want your help, and we're focusing in on people going to the dentist. We're bringing their infants to the dentist by age 1, and hopefully that's going to spread across the community. So the formal recommendation from both the American Dental Association as well as the Pediatrics Association is you're supposed to take your baby to the dentist at the latest age 1 or 12 months, or 6 months from eruption of the first tooth. So if you see a tooth and the baby is only 4 months old, then guess what? They better be at the dentist by the time they're 10 months old. That's the goal, okay? So, but at the latest, it should be 12 months old. Unfortunately, only about 10% of babies in the state of Hawaii go to the dentist by this deadline, our target deadline. So we want your help. Do you have family members that have infants? If you do, on a personal level, please remind them, hey, you know what, you're supposed to go to the dentist. And many children have healthcare coverage of some sort here, and that's largely thanks to your organization and what the work that you guys are doing. So we want these babies to go to the dentist. Or do you have, are you in community groups? Are you in churches? Are you in sports leagues? Are you in things where you can kind of help promote the message more than just one-on-one, but maybe to groups of people? We want you to help spread this message. And we also just want you to tuck it away so that you know that that's what the recommendation is. The goal of this is to prevent cavities from happening. And the goal is to build positive relationships in the minds of our neighbors and our community. We want people to be comfortable going to the dentist. And this starts with early appointments that focus on prevention, as opposed to delaying dental appointments until you have a toothache. And then now you might need to have your first dental appointment be something that's a little bit more of a difficult appointment. We want to keep it easy. Perfect. So we're asking for your help. And one of the tools that we have created to help you help us is we have some dentist by one referral resources that make it easy for you to spread the word to either Medicaid clients that you're speaking with, or you can spread the word in your community groups or churches or sports leagues or whatever it may be, parent groups, or you can just have these for yourself, or maybe you keep it on your desk and you pull it out whenever somebody needs it. But we have some resources to help remind people to get their babies to the dentist by 1. So we have this packet. We've distributed it on our own. We've distributed it to medical offices and to dental offices. There are posters and there are flyers, but we can't distribute it everywhere. We've used our existing network and distributed it to many places, including WIC offices and parenting classes and things like this. But we also want your help in identifying more places that maybe could benefit from having a stack of these convenient referral pads that show a map island specific. We have maps for each island, maps of all of the providers that take babies, identifying which ones are Medicaid providers, identifying which ones are private pay only, and it's all geographically mapped out. So if you think of, hey, you know what, you know who would benefit? This group would benefit from having this. Please share that with us, because we want to extend our distribution network and we need your help in doing this. There are posters and there are stickers and there are other things that go along with this, but we want your help in getting this information out into the public. So here's maybe a little more close-up of what I was just talking about. We have these island-specific maps. We have one for Hawaii Island, and we have it for Maui County and Kauai, and we have Oahu. And we update this. So these are the offices that are currently taking new patients, and there should be no delay in getting an appointment, even if you have Medicaid. So, and we update this every year. So if you look on this list and you refer somebody to somebody that has a family to an office that has a Q next to it, that means Q means Quest. These are offices that accept Medicaid Quest. If you look on the map, there are going to be a few offices that don't have Qs next to them, the names. Those offices are private pay insurance or cash fee only. Those are not Quest providers. So we tried to make this really easy. And like I said, this map is updated and it's current. So it's not going to be the case that people are going to get a wrong number or they're going to get an office that says, I'm sorry, we're full. This should be up to date. You can have this at your desk. We'll provide this to you. It's also available on our website. And for anybody who wants a stack of 50 of them, we have our packets of 50 that, like I said, we're looking for new partners to give this to for free, okay? So alongside our recommendation or our hope to get babies into the dentist office, we're also providing toothbrush kits. And these are baby-focused toothbrush kits. We're distributing them to birthing type medical providers. So OBG, hospital, nursing centers, things like this. So statewide, there are about 15,000 babies born in Hawaii every year. That's an approximate number. And we're distributing approximately 12,000 of these packets. So there are still a lot of babies that we're not going to be able to reach. If you can identify places that might benefit from this, we're happy to help. We're going to provide these toothbrushes and these packets free of cost. We provide them on our dime. So, and the idea is we just need to know the places that might want free toothbrushes. So this is, again, another one of these things where we're asking for your help. In addition to free toothbrushes, it has information that might be relevant for how to care for a baby's teeth. A lot of people might not know, like, what am I supposed to do with this baby? And do I brush it regularly? Do I need to floss? These are all questions that should be answered at a first dental visit that happens at approximately age 9 months or 10 months or 1 year at the most. But we also provide some of this basic information on this packet. Okay, so returning to the three things that I'm asking for your help. Number one, we want your help to spread the word for our existing programs. And that's not limited to, but it includes our scholarship programs. We love to give money to people who are seeking higher education, especially in things related to oral health and becoming oral health professionals of some level. We want your help in identifying partners that might identify from oral health education for caregivers to senior citizens or to special needs patients, to adults with some sort of special medical need or a special neurologic situation. And then also our distribution of toothbrush kits, and we have baby toothbrush kits, and we have adult toothbrush kits too, and we also have just child toothbrush kits. So if it's something, for example, a soccer league or the Boy Scouts, or it's something like this, these are all potential opportunities where we might be happy to distribute free toothbrush kits and information to organizations like this. And then finally, specifically, we want your help with our Dentist by One initiative. Again, the goal is to get all Hawaii residents to go to the dentist of all ages. But perhaps one way where we can stimulate that to happen is by getting babies to the dentist office by one. So we want your help, please, in passing out these referral packets and information, but also just spreading the word and making it part of our common culture. We want to educate culture. We want to kind of shift culture a little bit so that all cultural groups are aware that, hey, you know what? Early dental visits are a good thing. We don't want to wait until age 3. We don't want to wait until a toothache. We want all of our cultural subgroups to be going to the dentist at an early age. So those are the 3 things that I'm going to ask your help. If you have any questions, you're free to contact me or anybody else at the foundation. Okay, that's it for me. Thank you.
Awesome. Thank you so much. Okay, and I know that we're just a little bit running a little behind. I'll go through the final slides a little bit quickly. Thank you so much, Dr. Uchida. I won't say personally what age I took my kids to the dentist, but I just will say that I was not working for HDS at that time and I didn't know. So now I know better. And now that my brother has a 7-month-old, I've already been badgering them to make the appointment. So that's my contribution right there. A couple more things before we open it up for questions. I just wanted to share a little bit more about the Smile Well program. And so this is mainly for our employer groups. So if AlohaCare is interested, this is what we use. We help employer groups and other organizations encourage their employees to get to the dentist always. Whether it be for things like utilization numbers, we can package our program to fit your needs. So if you say want to have a goal of 50% utilization of dental benefits, we can help you work with that. We can provide a lot of educational materials on overcoming fears of going to the dentist, any misconceptions of the dental industry that one may have. Because there are many, many reasons why people do not see a dentist regularly. And this is just one of our ways to provide another resource and a tool for everyone to enable them to get to the dentist. Again, where you probably have seen our ads on TV, you're probably wondering, why do we have so much media? We actually really want to drive our members to the dentist, right? It benefits the member by getting their cleanings and their regular scheduled checkups. It benefits the dentist because then they have business. We're helping drive business to them. And it helps employers, right? People are utilizing the benefits that they have. So you'll see us providing a lot of educational material in the media. Next slide. And I think this is one of my last ones. Again, just thanking all of you for AlohaCare being a great partner with HDS. Being able to help disseminate information, provide educational information to the community, as well as creating these really great networks of dentists and medical providers on our behalf. I will say I was just so impressed with the supplemental Medicaid that was offered before, right? I think January 1st, 2023, the state is now going to pick up adult Medicaid benefits, which is something that AlohaCare has done long before the state ever has. So thank you so much for stepping up, for being that important oral health care partner and recognizing the importance of oral health care in our community. And so I do want to be sure that we have a couple of minutes of time left over. The hour goes by so fast, I can't even believe that it's almost over. So next slide is just for questions. And our final slide is really to thank and mahalo all of you for your time with us this morning. And even if you have questions following this webinar, we're happy to engage in any way possible. And so thank you. I'll turn it back over to Kealoha.
Thank you so much. I'm going to bring the slides down for a minute. And while we get oriented for question and answer time, feel free to insert any questions you have into the Q&A button on the bottom or the chat talk bubble as well. I'm going to launch our second poll. So it should be coming up on your screen now. This one is multiple choice. What conditions can be linked to oral health? One of the things that stood out for me as you folks were talking and sharing with us about the breadth and depth of your services is exactly what we're thinking about here at AlohaCare for healthcare system alignment. It's about building awareness. It's about sharing information. It's about collaborating and finding ways that resources can reach more groups across the board. And so we're really thankful that you were able to highlight some of those initiatives and projects that even our team could help to contribute towards. So thank you so much. That was really, really good information. And I know we want to dig into some of the questions that are going to come up. I'm going to pull the poll down in just a second, but for all three of our panelists to really think about that. We know that there are many barriers that have impacted and are impacting oral health and dental care in Hawaii. You actually named some of them. And one of the ones that you named was around the need for workforce development and the need for the investment in the workforce, when we know that there are real barriers. Like if a student has to go to school outside of Hawaii, they have to leave their family for a certain amount of time. School's not easy. These are rigorous programs. And then we hope they come home, right? Sometimes they get fellowships. Sometimes they get great job opportunities. Sometimes they get married and buy a house, right? So, are there solutions that you folks are seeing that we can help to contribute to as a collective across the healthcare system? Like, how can we build up more professionals that can meet the needs across all islands for Hawaii?
I'll take a first stab at that, if that's okay with you, Sherry or Gavin. So again, for workforce, again, all of those barriers that you just named are real. I will say most recent statistics show that dental school is even more competitive than medical school. It's also extremely hard for students coming out of dental school to even look at coming back home to Hawaii. So right, they have to leave to get their training. When they come out of dental school, the average amount of school loan debt is about $500,000. That's the average, right? So there are people coming out of dental school with more than 500,000. So imagine yourself in your late 20s, mid to late 20s with that much debt, trying to buy and build a practice, and then try coming home and buying a home in Hawaii. So difficult. We are going to be taking a look at either loan repayment. There's a lot of loan repayment programs out there. We know that it won't eliminate the debt altogether, but we want to try and find solutions so that they do come back home. It probably is, I will just say it outright, that it is probably more lucrative for them to stay on the continent and practice up there. But what we really want to do is build the community around these dentists, right? So you see legacy dentists, you see families passing through grandfather, son, or daughter onto grandchildren. And that's so Hawaii, right? We want to go to providers that we know, that look like us, that know what it means to run into people at Longs, right? And so I think that's where we're going to be looking to in the future, so that when we see, just like in the medical industry, a mass exodus of retiring providers and the new students coming out of dental school not fulfilling those vacancies, that's going to be even more of a huge issue for us. So I think we trail behind the medical field just a little bit in terms of trends. So if we can prepare now for that, it's already hitting us, obviously. And not just look at dentists, but also hygienists and dental aides. Those are just as important parts of a dental practice as well. So I'll leave it at that. I'll let the other two answer if they have any additional thoughts.
Yeah, I'll throw in a couple of ideas. So actually, statistically, Hawaii has a lot of dentists, more dentists per capita than most other states. However, the dentists in Hawaii are not evenly distributed. There are a lot of dentists on Oahu, and there are a moderate number of dentists on neighboring islands. So, but overall, on a state level, we have far more dentists than the state average across the United States. Where that can be improved upon is spreading across the dentist wider and distributing them onto the neighboring islands. Ultimately, a good way maybe to do that would be to adjust fee schedules so that dentists who are working on neighboring islands might be paid more, and that can encourage dentists to practice more on neighboring islands, regardless of where they reside. They can fly to a neighboring island and work, which is something that I do personally, and I know other colleagues that do that too. But your question, Kealoha, and I think where, as a community level, where we can really act is what Diane just said, is that dental assistants and dental hygienists are in a shortage. Dentists are not in shortage, but dental assistants are in high demand. So if you know somebody who's interested in going into dental assisting, where maybe all you need is a high school degree and you can get a good career, encourage them to consider that. Dental hygiene is a degree program through a university, and we have scholarships for that. And that's also a good area to look at too. So by increasing the number of dental assistants and the number of dental hygienists, we do even better than increasing the number of dentists in Hawaii, because each dentist now has a bigger team, and the team can see more and more people. So I would say for workforce development, it's easy to talk about we need more dentists, and it's easy to say that, but that's not statistically true. What we need is more dental team. So we need dental assistants and dental hygienists.
We do have, I saw, I think about 3 questions that came in, and so I want to make sure that we bring those up. One of them we have is Danielle is in our health coordination team, and it sounds like they do know some providers who would be interested in those packets and some of the information that you folks hand out. And so our health coordination team is wondering what's the best way for those folks to contact you to be able to provide that bridge and link you to those sites that the distribution of materials might be able to be made.
Okay, you can either call us at 808-529-9277. That's aligned to our foundation, or you can email us at foundation@hawaiidentalservice.com. We have a lot of that information on our website as well, hdsfoundation.gives. So either way, please reach out.
Great, thanks, Sherry. And then we had another question. And it looks like, Diane, you're so on it. You're like in there, you're like typing.
I'm trying.
Right now. Are you folks working with any of the Native Hawaiian healthcare systems? So one of the questions was, especially around those that are on neighbor islands, such as Hui no Keolapono on Maui, or Hui Malama Olana Oiwi on Hawaii Island. Are you folks working with Papa Ololokahi and any of the Native Hawaiian healthcare systems?
I'll answer that. I think Diane is busy.
All right, I'm trying to answer the next question. The answer is yes. So go ahead, Sherry.
Yeah, the answer is yes. We have either funded or worked with all of the Native Hawaiian groups here statewide. So I think there was a question there asking if we worked with Hui no Keolapono. We work very closely with Dr. Emi Orikasa, the dentist at Hui no. And we have, in fact, Dr. Orikasa is on our board as well for HDS and for HDS. And so we work closely with them as well.
Thank you so much. And then I see Diane is actively typing into the Q&A. I wanted to bring this up in case some folks might be on their device and not able to see the Q&A screen. So the question is really around orthodontic services are extremely expensive. They're noting especially trends that they're seeing on neighbor islands. And there's numerous dental issues that could be prevented, right? And so it's asking if there are future initiatives to help offset those costs besides the $1,000 lifetime benefit. And additionally, if there are any instances when a provider can request orthodontic services for their patient who have met the lifetime benefit for their coverage. And so, Di, I know you did type a really great answer there, and I was just wondering if you wanted to just share a little bit of that out
Sure.
for everyone.
Sure. So again, the coverage of the $1,000 per lifetime is dictated by the employer group, right? So depending on who your employer is, they may or may not have different benefits specific to orthodontics. We are looking at perhaps offering a little bit more, which would be up to the employer groups to decide whether or not they want to accept that, right? And have that plan on behalf of their organization. But I understand, right? And I just kind of read through the question really quickly, but if orthodontics do help with medical issues, some of the things that we need first are data. And we have started looking into it very, very superficially, but we need to dive a little bit deeper into how those types of what was previously seen as more cosmetic orthodontics, right? How they link to things like sleep apnea, TMJ issues, or whatnot. And so I think the first step is we need to really look into that and try and dive a little bit deeper so that we can understand how certain things relating to orthodontics are really having profound, maybe years down the road, medical issues. But that is on our radar. So thank you for having that question. I have 3 daughters, and of course, I also have lived through 2 daughters maximizing their lifetime benefit of orthodontics.
I see there's another chat question here, and I think it'll probably be the same. So there's a question on folks really do want to learn more about the hygienist program and opportunities for scholarships, especially for local students that live here. I'm assuming that they can find that information also on your folks' website too?
Yes, at hdsfoundation.gives. It's on there.
And is that so maybe for the timeline might help them, is that is there a specific time period in the year where that process gets open for applications that we could refer folks to?
Right. The applications are not open yet for the school year 2023-24. That would be the next period. And I believe the University of Hawaii applications open in November. But we're going to be updating our website that will be able to share in November a link to the UH Foundation Scholarship for Dental Hygienists, and then also another one. This is where we're creating 2 different ones this year. The Hawaii Community Foundation link, and that would be a application for dental students to apply. So there'll be 2 different routes to take depending on what profession you're studying. But it'll be all on our website, hdsfoundation.gives.
Great. Thanks so much, Sherry. Sherry, Dr. Paloma, Dr. Uchida, any last closing comments that you wanted to share with everyone? Our session did go by really fast, and we were able to share a lot of information, and I'm sure there might be a couple of extra things that we want to make sure we sneak in before folks log off to their next meetings for the day.
I'll just add, I'll say, make sure you see your dentist.
Same here. I think we try to remind people of 3 important steps to good oral health: brush twice a day, floss once a day, and see your dentist regularly, like Diane mentioned.
I'll say sugary beverages are bad for you.
Yeah.
Look at the range here. See, this is why we do these. It's because everybody has their own little flavor that they can add to us today. And you know what? I'm going to remove those from my tutu's hale. She has those too. They came actually home with her when she was discharged from the hospital. And I just learned that today. And I'm going to take them away, and they're going to go in the recycle bin, I think. Yeah. We want to keep her mouth clean. We don't want to spread germs. I'm going to put up on the screen really quick here just to share out the results. We know because of the presentation today that please help us build the initiative that Keiki should be going to the dentist before they turn 1 and 6 months after the growth of the first tooth, because they can get cavities, even with their baby teeth. And I'm just sharing up on the screen right now what conditions can be linked to oral health. Why is dental coverage and care really important? This was a trick question. Every single one of these conditions, cardiovascular disease, pregnancy and birth complications, pneumonia, diabetes, substance abuse, and many, many more health and medical conditions can be linked to good oral health. And so we want to make sure that we continue our work and our efforts with HDS and our healthcare system alignment through our collaboration and partnership together. We believe this is part of the reason why and how a healthier and more equitable Hawaii is possible. And your folks' work in the oral health and dental care sector, working across factors like education and income and geographics, are all important to the ways that we can elevate and improve all of the goals that our organizations share around whole person care and whole person health. We're going to wrap today's webinar. I really want to mahalo nui to Dr. Paloma, Shere, and Dr. Uchida, and the entire Hawaii Dental Service team and the Hawaii Dental Service Foundation team. It's been really great to work with you folks. For me, it's been over 3 years since I came to the organization and was working with you folks since the beginning. Your time and your expertise and generous sharing today on initiatives, projects, and ways that we can get involved is really helpful. And thank you for your work for decades, 6 decades now, for enriching healthcare change in Hawaii and bringing more healthy smiles across our island home. Thank you too to our AlohaCare leadership and team for supporting this effort. We believe in health equity, we believe in social determinants of health, and we believe in culture as being a leading foundation and factor to bring all of us together more to share in these improvements across our organization and across Hawaii. Share ideas with us, be well, and smile throughout your day today as you go on to your next meetings. These episodes are loaded on our YouTube page and Aloha Lines for further reference and recording. Thank you again, HDS. Be safe and stay well, everyone. Mahalo nui oko. Aloha.
Thank you. Aloha.